However breathtaking the wild coast in the Eastern Cape may be, it's difficult to lure doctors to this remote area.
Rural areas in South Africa suffer from a lack of doctors. I mean, most people don't want to work in rural areas. It can be very frustrating and it can be very draining. You see a lot of people that are very sick. There's always people that are dying. I'm a doctor from the Netherlands. I work in S9E12 Hospital, which is somewhere it's difficult to find actually. And the hospital is located on a 17-kilometer dirt road. And I live next to the hospital on the premises. I've done a specific training program in Holland to become a rural doctor. And Africa Health Placements came to promote working in South Africa. So I met them there. They told me about S9E12 Hospital, which is a very rural hospital. And they offered me a job here.
Africa Health Placements was started in 2005 when a rural doctor saw the real need for more health workers in rural areas. We focus on countries that have traditionally actually taken our doctors, and we're trying to reverse that process and get doctors to come here.
Africa Health Placement has been a great blessing for us. For them, they're willing to help, they're determined, they're devoted, and they're even ready to tolerate the conditions.
You work in a very rural hospital in the middle of nowhere and you have to be able to do everything. So we do surgery, cesarean sections, we perform anesthesia, you learn how to do ultrasounds. There's quite a lot of trauma as well, so you need to put in chest drains. HIV and TB is very big, so you need to learn about HIV medicine, and we got some additional training, so now I'm also an HIV specialist.
If you call the doctors to come to the patient, irrespective of time, they are always willing to help. They are ready to give the advice. They don't get tired. They are working endlessly.
Marja is one of the 3,000 foreign qualified and local doctors who have been recruited in partnership with the Department of Health and the South African Health Professions Council. See you after the break. Welcome back to Port St. John's, where Dutch doctor Marja Grootwaard's mission is rooted deep in her heart, emulating Albert Schweitzer, who dedicated his life to healing in Africa.
I became a doctor because I enjoy working with people, and I think it's a beautiful thing if you can help another human being. I went through some surgery myself at some point, and I think after that I decided to become a doctor because the impact it had made on myself as well.
Ndaphila ndinengxaki umlenze wam udumbile was sweating ngase ngiba kuphelile ngam.
Ngo-2013 ndiye ndaba nengxaki yesisu esaye sandikhupha amanzi omzimba, then ndashiyeka ndinomzimba omncinci. Kade ndihamba ezibhedlela but andifumani ukuncedakala. Abangani bam bebendosaba ngoku bethi ingathi bazondiluza, besoyika nokundibulisa ngoba besebephelelwe lithemba nje.
Ndadibana noDr. Marja osebenza esilimela. Wandixelela ukuthi no, anganceda ngezinto ezithile. Amayeza ndizama ukutsho kanjalo. Sendaba right, ndipholile ngoku ngenxa yoncedo yalasisi uDr. Marja esibhedlela.
Kumnandi kum ngoku sendiphilile nabantwana bam bayavuya. Ndastophisha nesesisu through i-medication endiyenzelwe nguye. Ndabeke ngoku ndiyakwazi ukubuyela emsebenzini properly nesebenza.
Although it's very hard and difficult sometimes, also very rewarding because people appreciate you a lot because they know you'll come here, and if you wouldn't be here, they might not get any help.
Working with them, it's making us to be so comfortable because they are ready to work as a team. We don't feel that they are doctors, we are partners. We can share views. Where we don't understand, they're able to share with us. Ever since they came here, well, there's a difference in terms of skills, experience, and what they've given by them to us.
I think it's very special to be in South Africa and to be so welcomed by the community. Obviously the Transkei, it's still community land, so it's like you become part of community if you go and move to this area. I think it's a beautiful, warm culture, and people are caring, and I can learn as much from the African culture as they can learn from maybe my training that I received back home.